So I've known I wanted to be a physician since a very young age. I didn't know exactly what that meant at the time, but I remember having strong impressions that this is what I wanted to be. And I feel very grateful that I am able to practice medicine and take care of my patients. It's not really a job to me. When I come back from vacation, I take time off with my family. I look forward to coming back. I look forward to helping my patients overcome some of their challenges. One of the things that drew us to Utah and to really start Southwest Spine and Pain dates back to my fellowship when I was a fellow at the Mayo Clinic. I remember sitting in a meeting and they were talking about the opiate crisis. And one of the things they said was that Utah was very high as far as prescription drug overdose events. And I remember thinking, having grown up in Utah, have a lot of family in Utah, that something needed to be done to change that. So when we came to Utah, our goal was to try to create a pain practice and help deal with the opiate epidemic at the time by providing treatments in addition to opiates that could help alleviate people's pain. The reason we had an opiate crisis is because we have a chronic pain crisis. There's 100 million people in the US that suffer from chronic pain. And it's everywhere in that sense. So it's common and it touches lots of people's lives. Good intentioned physicians were trying to solve a very complex problem. And in those days, you didn't have a lot of tools in treating pain. Opiates or medications were one of them. Fortunately now, there's a lot of things we can do besides just giving medications to treat people's pain. Doesn't mean we don't use medications, because we do, but we use it in ways that augment additional therapies. And one of the advantages of being in a place like Mayo Clinic, and I spent some time at Johns Hopkins, is that you're able to see kind of the cutting edge of what's coming and what's currently available for patients. So our goal when we started Southwest Spine and Pain was to really bring all the therapies and the latest technological advances to treat patients with pain. And when I look at my patients, I do everything I can to try to say, how do I help them and not give up on the situation. That doesn't mean I can help everybody, because there's limitations to what we can do, and those are some of the struggles that you have, and that's the burden of being a physician. But I try to make sure that I've done everything I can, and if I can't, I'm very honest with my patients. But if there's things that we can do, I make sure they have those opportunities.